For the single leg hip rotation, what we're trying to do here is actually quite simple. In this position, this is a closed chain position. So notice how my pelvis is on the ground, my upper body's still, my feet are on the wall. There's really not a lot of ways I can wiggle out of this. So when I ask my right ankle to be brought to my left knee, I'm testing, can my right hip flex and can it externally rotate? And I'm really trying to understand, is that a function that can happen? Now, this is obviously what happens when the hip can function really well. It can flex and externally rotate, no problem. My pelvis doesn't have to move around at all. So if my hand is on my pelvis, it stays exactly in place. This means that my hip can rotate within the socket of my pelvis. This is wonderful. Now, if my hip can't rotate, what I'm gonna do is lift my pelvis off the ground, swivel it to the side. Sure, I get rotation at the hip, but it's not really rotation at the hip. It's me twisting my lumbar spine and shifting my pelvis out to the side. My left pelvis is now closer to my ribs than my right pelvis is. And this is one way that I can cheat, right? My hip still looks like it's rotating out, but it's not. If I were to put that pelvis back into alignment, the hip can barely rotate. So the number one thing that we're looking for here is, can the hip flex and externally rotate without any restriction? That's what we're looking for. If you find that your hip can do this, you've got pretty great function in a flexed, rotated position. If you find that you've got to lift the pelvis up, this is your lumbar spine, your lower back learning that it has to move for you to even think about moving your hip, if you can move your hip at all. And this test is such a brilliant way to understand back pain, because if every time you try to move your hip, you actually do it by flexing the pelvis back, lifting it up, and rounding the lower back, think of what happens every time you step, every time you sit and stand. Anytime you're asking your hip to flex or rotate, if this is what naturally wants to happen here without motion, what's happening when we're squatting, when we're deadlifting? What's happening when we're running or bending forward? We're not moving our hip. We're moving our lumbar spine and twisting our pelvis because we don't move our hip. So understanding this compensatory pattern is a really key indicator. And if you can't do it, then this is going to be such a great opportunity to understand how your body moves and feels, going from this having to manipulate everything to then just being able to move your hip and ask it to be a hip when it needs to be.